So here's a little story time on how I ended up like this.
If you haven't watched that video, please go ahead and watch it. It is someone who recently underwent chiropractic manipulation and ended up with a cervical artery dissection. I figured this is now a good time to discuss what dissections are and what to watch out for. If you don't know me, I'm Dr. Billakota. I'm a board certified neurologist and epileptologist. We have blood vessels that feed the brain that come off of our heart and are connected to the rest of your body. The most common ones are the common carotid artery and the vertebral artery. The common carotid is the artery on the right, and the vertebral is the one on the left. Those are the ones that are usually affected in terms of strokes. Now, with chiropractic manipulation and any kind of whiplash injury, actually, I've seen dissections with whiplash, roller coaster rides. I've even seen folks who went kayaking who've had dissections. But anytime you have rotation of the head in a forceful manner or going back and forth, you can dissect these arteries. What does dissection mean? Well, basically, if you look at the diagram below, that's the normal blood vessel. That's the normal lumen of the blood vessel, which is what coats the blood vessel. The one above is a dissected blood vessel. As you can see, the lumen, which is the yellow part, is not smooth anymore. It's actually torn, it's dissected. And behind it, you have the formation of a clot. These clots are dangerous because they can go up north and cause strokes. This is a CT angiogram, which shows dissection and the clot. And that, by the way, it's the golden standard for diagnosis. You need a CT angiogram to make the diagnosis of a dissection. Symptoms can include any of the above. This is specific for vertebral artery. For carotid arteries, you can have other symptoms. You can have visual loss. You can have trouble with speaking, trouble understanding language, trouble moving one side of your body or the other. Typical stroke-like symptoms. Treatment here is with an antiplatelet or an anticoagulant. Antiplatelets are aspirin or Plavix. Anticoagulants are heparin or warfarin. Now, this really depends on the extent of the clot. Sometimes if you have an extensive clot, you can do surgery to take it out. If it's something that is mild, you can probably get away with aspirin or Plavix. If it's a moderately sized clot and you have other risk factors of stroke, you will get on an anticoagulant such as heparin or warfarin. The duration of treatment is usually 3 to 6 months, but you are going to get interval imaging if you haven't cleared the clot, and interval imaging can be CT angiogram or ultrasounds, depending. If you haven't cleared the clot, you will continue to stay on an anticoagulant. So although chiropractor manipulations aren't the only way you can get this, they are a big part of the reason. I would also avoid chiropractic manipulations if you are someone who has a collagen vascular disease or other degenerative bony disease, autoimmune conditions like ankylosing spondylitis. You could also be at risk for that.